My name's Yvette Jiang, and I'm an OBGYN serving the community of El Paso. I wanted to become a doctor ever since I was a little girl, but I was drawn to the field of OBGYN more in medical school. So at that time, I was able to see the continuity of care and the relationship that we're able to build with the patient, not only through the pregnancy, but throughout their lifetime. So I love the ability to build a relationship with a patient. I treat a broad spectrum of patients, so both OB and GYN. So for OB patient, throughout the entire pregnancy, whether they're low risk or high risk, or even if they're starting high risk, I walk them through their entire pregnancy. Or if they start out low risk and develop high risk features, those are something that I also take care of as well. And for GYN, I do a broad spectrum from anything from their annual screening to any problem visit. So commonly any abnormal bleeding, any pelvic pain, STD testing, as well as perimenopausal symptoms. I also operate, do surgery. So if any of the patients that require their management to eventually require surgery, I also do hysterectomies, tying tubes, so BTLs, so anything that the patient might need. So I see anywhere from age 14 to way beyond menopause. What I believe makes a strong doctor-patient relationship is honesty, being transparent, and as well as empower the patient to know more about their health care as well as their health, and that way they can make the decisions on their own with my guidance, of course. So I believe that all of those things can empower the patient to know more about themselves and the final decision that we make for their health care. I did my residency in El Paso, so I spent many years taking care of the patients through residency, but after residency, I decided to stay in El Paso because I fell in love with the patient population, how kind everyone is, and their warm nature. Everybody seems so kind and respectful, as well as I love building that relationship, and they become essentially family at the end of the day because of the relationship we're able to build. I still enjoy the entire broad spectrum of OBGYN, so I haven't narrowed down to a niche, so I still enjoy OB as well as GYN and surgery. I am trained in laparoscopic surgery. Seeing them from the beginning of their pregnancy to the end of pregnancy is a really rewarding experience for all the patients I'm taking care of. When I'm not at work, I usually enjoy spending time with family, and I love yoga, so I try to get into the yoga classes as much as I can.